Hey guys, what's up? Well, I was gonna say we're the twin doctors, and as you can see, only one of the twin doctors is here right now. Myself, Dr. I. Dr. J is finishing up with the patient. He is in the building, and he will be here within the next few minutes. But I'll carry the show until he gets here. So today we're talking about diabetes and Biz Markie. Now, obviously, a lot of folks, from my generation, someone in his early to mid 20s, mid 40s, but we know Biz Markie very well. And while his passing is unfortunate, it gives us the opportunity to shine a light on something that is really affecting many Americans, many people worldwide, but especially many people of color, many African Americans, and that is diabetes. As we know, diabetes or complications related to diabetes is what unfortunately led to Biz Markie's death. For a multitude of reasons. Live TV, let me turn that down. That's my mama. For a multitude of reasons, people of color and primarily African Americans have a higher incidence of diabetes. Most people know, or maybe don't know, but there are two types of diabetes. There's type 1 diabetes and there's type 2 diabetes. Type 1 diabetes is what they generally will call juvenile or childhood diabetes. And that is diabetes related to decreased production of insulin by the pancreas. So the pancreas is this organ in our body that produces insulin, and insulin is this hormone that drives our blood sugar down. It drives blood sugar out of our blood and into our muscles and other tissues that need it. So type 1 diabetes, more common in children, is related to the pancreas just not making enough of that insulin. The most common type of diabetes in Americans, and again in African Americans, is actually type 2 diabetes. And this is the type of diabetes where you have normal insulin levels, where your insulin levels may even be above normal, but your body's not able to handle that insulin, what we call insulin resistance. And for a lot of people, that insulin resistance is related to lifestyle. It's related to obesity. The more what you call adipose tissue you have, which is fat tissue, and specifically the more central adipose tissue you have, so this fat tissue that's kind of laying around the belly, the more of that you have, the higher your insulin resistance. The more resistant your body is to insulin, the higher your insulin levels will be, because your body's like, hey, I'm making this insulin and the body's not responding, so it makes more and more and more. So your insulin levels are actually really high, but because of this insulin resistance, your body just doesn't respond to it, and so the blood sugar stays in your blood. It doesn't go into your muscles. It doesn't go into those tissues that need it, and the blood sugar gets higher and higher and higher. I remember growing up hearing, my grandmother and my grandmother's friends and, people in the community say, diabetes is just, it's a little sugar. I got a little sugar, kind of downplaying it, thinking it's just, high blood sugar. How bad is that? What people don't realize is that diabetes is actually a vascular disease. It's a disease of the blood vessels. When you think of it that way, you realize that it's actually much more serious, right? Because your blood vessels are kind of important to live. If you don't have blood flow, if you don't have blood vessels, you're not going to live, right? And so our blood vessels are responsible for taking blood, i.e. oxygen, i.e. nutrients to our brain, to our hearts, to our muscles, to all of our organs. And so when I say that diabetes is a disease of the blood vessels, basically what's happening is, oh, hey, Dr. J has blessed us with his presence. He is here. All right. When I say that diabetes is a disease of the blood vessels, what happens is when your blood sugar is high, because you have arteries, right? These are the blood vessels that take blood from the heart to your organs. And then you have veins, live again, sorry, which that's the blood vessels that take the blood and the waste from the organs back to the heart, to the lungs, right? And so when I say that diabetes is a disease of the blood vessels, you have little blood vessels that go to all your different organs. And so when your blood sugar is high, think of the blood vessel as just a big circular tube, right? The blood sugar starts to lay down in the tube, making the tube smaller, until you get less and less and less blood flow. But you have blood flow to these organs for a reason. If you're not getting blood flow to your heart, you have a higher risk of heart attack. If you're not getting blood flow to your brain, you have a higher risk of stroke. If you're not getting blood flow to your kidneys, why diabetics are frequently on dialysis, you have kidney failure. If you're not getting blood flow to your limbs, you lose circulation to your limbs, and you can actually lose your limbs. So this is why diabetes isn't just a little sugar, it's actually a vascular disease. Go ahead.
And I was going to say, part of Dr. I, when he was explaining the whole pathology and pathophysiology behind diabetes, I don't know if people picked up on it, but what he was saying was, and it's not just with diabetes, there are other conditions as well, high blood pressure, high cholesterol, but they all do the same thing. They progressively damage the blood vessels. Now, the key word there is progressive, because, oftentimes people see, in the case of someone like Biz Markie, I believe he was in his 50s, right?
Like 53,
Yeah. And you'll start to see manifestations of these, people who have high blood pressure, high blood sugar, high blood cholesterol in their 40s, 50s, and 60s. And so people think of this as being a disease of people who are in their 40s, 50s, 60s, and beyond. No, they are diseases of people in their teens and 20s and 30s and 40s. What's happening is the diseases are slowly progressing, but they're always there. And then they manifest in their 40s, 50s, and 60s, because like Dr. I was saying,
the tipping point.
Exactly, like Dr. I was saying, basically our blood vessels, they're layered, right? And so when you have high blood sugar or high cholesterol or high blood pressure, you get tears in one of these layers of the blood vessel. And then you lay fat in there, i.e. cholesterol if you've got high cholesterol, or you lay sugar in there if you've got high blood sugar. And then your body says, well, wait a minute, cholesterol's not supposed to be there. Sugar's not supposed to be there. So then it sends cells from your immune system to kind of plug that up. Problem is, now you got a little plug there. And then you do this again, and you do this again, and you do this again. What ends up happening is the blood vessel gets smaller, and it's not that the blood vessel is getting smaller, but the lumen of it, or the central portion of it's getting smaller, because it's filling with fat and sugar and what your body's put there to heal that area. And so eventually the blood vessel gets so small that the blood flow through it is compromised. Now we're talking about blood flow, like I said, to your limbs. If your limbs don't get oxygen and your limbs don't get nutrient, they die. If your brain doesn't get oxygen, there's going to be that tipping point where the blood vessel has gotten so small, there's not enough oxygen going to a critical portion of the brain, and you have a stroke. Now, you may have that stroke because that blood vessel got blocked and there was no blood flow going past that blockage. Or what happens is your blood vessel's like, I can't remain blocked like this. It becomes weak and it ruptures. Either way, be it that the blood vessel ruptures because it's weakened from that plaque that's formed over all of those years when you were in your teens and 20s and 30s and 40s, and ruptures, or be it because the blood flow is blocked by the little plaque that forms. You don't get blood flow to the brain, you have a stroke. You don't get blood flow to the heart, you have a heart attack. You don't get blood flow to the kidneys, you have the kidney disease, which ultimately leads to the dialysis in diabetics. And so I think one of the main things, one of the big key points is, diabetes is not a disease of people in their 40s and 50s. People will see that Biz Markie died in his 50s from diabetes or complications of diabetes, and they think, well, I'm in my 20s, I'm in my 30s. I'm good. I've got time to get it together. No, you need to get it together right now, because it will manifest in your 40s. It will manifest in your 50s. It will manifest in your 60s. But it's manifestations of problems that began in your teens and 20s and 30s and 40s.
And exactly. And so I think the question would be, how do you get it together? And I see all the comments. Thank you guys so much. I love to talk. Believe me, I do. My wife will tell you that. But we're also here to answer questions. So if you have any questions, please ask them. So Linda said, I am pre-diabetic. So that's actually a good thing to kind of discuss. Let's use that as a segue when I say, what can we do to prevent these things from occurring? So when somebody said to be pre-diabetic, remember we're talking about that whole insulin resistance thing, how your body is not underproducing insulin, it may even be overproducing it, but your body's just not responding to the insulin well. That's generally what they call pre-diabetic. So what I would encourage everybody to do, and something I've been doing since I was about to tell myself, since I was in my late 30s, but I'm in my 20s, so how's that possible? Something I've been doing since I was in my late 30s was checking a blood test called a hemoglobin A1C, or A1C for short, okay? Hemoglobin A1C is a blood test that basically kind of lets your doctor know, on average, what your blood sugar's been looking like between the last 3 and 4 months. Hemoglobin A1C, if it's above what they call a 6.5, that means you're diabetic. If it's between the 5.7 and the 6.5, that's what's known as pre-diabetes or pre-diabetic, and that's when you want to catch it, okay? So I would tell everybody, ask your doctor when you're getting your routine blood test done to do a hemoglobin A1C. If it's less than 5.7, you're good, but it's between 5.7 and 6.5, you're pre-diabetic, and this is the time to make those lifestyle changes now. So what are some of those lifestyle changes? Number one, first and foremost, the one that sucks the most, the one that I hate, but the one that is the most important. Diabetes, by and large, is a disease of lifestyle and obesity. You have to lose the weight. And I'm not some skinny person sitting up here telling you how much you have to lose weight. Like, I have probably lost over my life like 300 pounds, tons in like 50-pound increments. Like in med school, went up 50 pounds, went down, went up, went down. So I know it's hard, but you've got to lose the weight. First and foremost, that is the most important thing. Second of all, something I tell people to do, and I do it all the time myself, cinnamon. If you take cinnamon tablets, 4,000 milligrams of cinnamon every day, that actually helps to reduce your blood sugar. What are you going to say? I thought you were going to say no. Fish oil tablets. I take four, and these easy numbers to remember because they're all the same. 4,000 milligrams of cinnamon every day, 4,000 milligrams of fish oil, omega-3 fish oil every day.
Another easy thing you can do, like you said, cinnamon, fish oil. Another thing that is critical for everybody, but especially for African Americans, because we got this beautiful brown skin that blocks the sun fantastically, is vitamin D.
Yep.
Vitamin D deficiency increases your risk of not only diabetes, but certainly diabetes, which is what we're talking about today, but it increases your risk of certain cancers as well. And our bodies make vitamin D in large part by absorbing the sunlight. Well, because we have, this constant tan, it protects us from the sun, which is why we have lower rates of skin cancer, because we block the sun's rays.
We still can get it. So we're at SPF 30. Side note, keep
we
going.
can still
Sorry.
get it. So we're at the SPF 30, like he said. But because we block the sun's rays effectively, we don't make vitamin D as well. And so while low vitamin D is common for everybody, it's more common for African Americans. So do vitamin D every day as well. So like he said, 4,000 of cinnamon, 4,000 of I'm having a brain fart. The fish oil,
and then 2,000 of vitamin D. It's half. Easy to remember. 2,000
to 5,000 international units of the vitamin D. Add cinnamon to the coffee. Absolutely. That's easy to do.
It doesn't have to be like I take tablets because I don't know. I just take tablets. But you can put it in your coffee. You can put it in a smoothie. You can just put it on your tongue. You can put what? One thing is that when I was a kid, actually, my grandmother would make cinnamon toast. A little butter. We're going contradicting ourselves a bit with the butter and the cholesterol, but a little bit of butter and cinnamon. But the point is, cinnamon in any form, as long as you get 4,000 milligrams of it every day, it does wonders. Because I will tell you, when I checked my hemoglobin A1C, I don't know, this is maybe like 10 years ago now, when I was in my teens, when I was in my 30s, my hemoglobin A1C was like 5.6 or 5.6. It was like right at that border, and I freaked out. And so that's probably like the third or fourth time I got to the gym and lost some weight again. But I started taking that cinnamon, and my hemoglobin A1C went from a 5.7, which is right at the borderline, to 5.2 over a matter of maybe like 3 or 4 months. So cinnamon is a huge thing you can do. But again, it's weight loss, it's exercise, lifestyle changes are the big things.
I was just going to say, and it's like you said, weight loss and exercise and diet and supplements like cinnamon and fish oil and vitamin D and all of that good stuff. But, we hear people talk about weight loss all of the time, right? Weight loss. The reality is that we all think that we know how to lose weight, but do we really know how to lose weight? And oftentimes we don't, because, we know that it's the very basic math of more calories in than out equals weight gain, right? And more calories out than in, weight loss, right? But how much should you be eating to lose weight? And this is something I hammer home with my patients because I hammered it home with myself. Like Dr. I said, medical school is very stressful. I started medical school at a nice felt 170. Midway through medical school, I was tipping 240. I gained like 65, 70 pounds, and so I know the battles of gaining weight and trying to lose weight. And so I found myself doing what doctors tend to do. I started to do research, and I'm like, well, how do I lose weight? What do I need to know? And there are some very basic numbers that you need to know. The first is just 3,500 calories. That's a very important number. Why is 3,500 calories important? For this reason. For every 3,500 calorie excess you consume, you will gain a pound. Conversely, for every 3,500 calorie deficit you have not consumed, you will lose a pound. Okay, so you're trying to lose weight. Let's say that you're 240 like I was, or close to 240, and you want to get down to 170. Okay, you want to lose 70 pounds, right? So what are you going to do? So first thing you need to know is how many calories you should be eating to maintain your weight. Okay, so there's something called the BMR. There you go. 3,500 calories is the magic number. So there's something called a BMR calculator, basal metabolic rate calculator. You can Google it. 1,000 sites have them. They're all the same. So BMR calculator, basal metabolic rate calculator. And it will ask you some very general information, age, weight, gender, and activity level. And you have to kind of spitball the activity level, but it kind of will give you some parameters, what level you're at. And then you'll put all of this information in, and the BMR, basal metabolic rate calculator, will tell you you need to eat this number of calories every day to maintain your weight. So let's say that the BMR calculator says that you need to eat 2,000 calories. We'll use a nice round number. So the basal metabolic rate calculator says that you need to eat 2,000 calories a day to maintain your weight. Okay, 2,000 calories, you're not gaining, you're not losing. So subtract 500 from that. So instead of eating 2,000 calories a day, you're eating 1,500 calories a day. Guess what? 500 calorie deficit a day, 7 days in a week, you're at a 3,500 calorie deficit a week. So if you go to the BMR calculator, find out how many calories you need to eat every day to maintain your weight, subtract 500 from that number on a daily basis, you will have a 3,500 calorie deficit every week. That means at the very least, you're going to lose a pound a week. Now, just like you said, it's diet and weight loss, but it's also exercise. So if you burn an additional 500 calories a day, because you're exercising and burning these calories, now you've got a 500 calorie deficit from what you didn't eat, plus a 500 calorie deficit from what you burned. Now you're at 1,000 calorie deficit a day. Still 7 days in a week, 7,000 calorie deficit over the week, you're losing 2 pounds. So remember, 3,500 calories. And don't just remember for weight loss, remember for weight gain as well. For every 3,500 additional calories you eat above and beyond what you need to eat.
For those weirdos that need to gain weight. I've never understood them. They exist. They exist.
Well, it's not just people who need to gain weight, but also, you know, when you're having your cheat days and when you're doing something you shouldn't do, which we're all going to do, at least keep in mind, okay, if I'm eating 1,000 extra calories today, well, I'm probably going to put on about 0.3 pounds, you know? So just remember, 3,500 calories is the magic number. For every 3,500 calorie deficit you have, you lose a pound. Every 3,500 calorie excess you have, you gain a pound.
Okay.
BMR calculator, basal metabolic rate calculator, use the number, subtract 500 from that, you'll lose a pound a week. Burn more, you lose even more, and that's how you actually lose weight.
So we've talked about that old adage, an ounce of prevention is worth a pound of cure. And I've heard that beetroot is excellent for blood vessels as well. Can you touch on that? So yes, absolutely. Okay, so let me tell you something. So I will tell you one thing. Yes, beetroot is excellent for blood vessel health. I will tell you, as I think Jamil and I have kind of mixed training in the sense that we are allopaths, right? So we went to medical school, you know, we're trained in traditional medicine. But also we grew up with a hippie mom who, you know, when I had a stomachache, gave us aloe vera and, you know, all these shit. And herb class, still go to her for herb recommendations, you know. So we've kind of got a little bit of both, you know. And so yes, there are, you know, lifestyle changes that you can do. There are medications you can take if need be. But I am a firm believer that a lot of, you know, a lot of the cures for what ail us are here on this earth. And yes, beetroot is one of those things. Beetroot has anti-inflammatory properties.
I was going to say it's got antioxidants.
It's an antioxidant. It's an anti-inflammatory. And so antioxidants are good for almost every organ in your body. I was going to say from the brain down to the toes. It's good for every organ in your body. A lot of
and maybe just bring it home a little bit because we talked about this whole process, right?
A lot of things are related to inflammation. We think of things like arthritis as being inflammatory, right? Obviously, yes. But almost any condition in your body is related to inflammation. And so when you use anti-inflammatories like beetroot or any other antioxidant, cherries, for example, I just had a smoothie with cherries in it. The antioxidant, the resveratrol. You know, there are a ton of antioxidants. They absolutely help with body-wide inflammation. And again, remember this, diabetes is a disease of the blood vessels, right? And you get this inflammation in the blood vessels.
And that's what we said. Remember, what does your body do when it wants to fix a problem? It creates inflammation. You twist your ankle gets swollen because your body sends all of these cells and proteins there to fix that injury, right? What did we say about high blood sugar earlier? It damages the blood vessels. Your blood vessels like, hey, sugar's here. Your immune system's like, hey, sugar shouldn't be there. I'm going to send all of these inflammatory cells and proteins to fix that. Now you've got this chronic inflammatory process because you're eating too much sugar. Your sugar is depositing in the blood vessels. The blood vessels say, we don't want the sugar there. Your immune system says, we're going to get it out with inflammation. And you're chronically inflamed. And inflammation is what leads to damage of the blood vessels. Damage of the blood vessels is what leads to the long-term sequela of the diabetes. So that's bringing it all home. And that's why the beetroot and for the most part, they say your plate should look like a rainbow. Anytime you're eating any of the colored vegetables, including beetroot, you're getting a lot of antioxidants, and antioxidants prevent inflammation, and inflammation is what screws everything up, to be honest with you.
Exactly. Okay, so we've talked about the ounce of prevention being worth a pound of cure, and it absolutely is. So diet, exercise, antioxidants, cinnamon, fish oil, beetroot, all of those things. Excellent. But what about folks that have diabetes? Is it too late? You've got diabetes, so your life is over? Absolutely not. Like we said, the diabetes is a condition of the blood vessels, but by and large, for most people, especially most people of color, it is also a condition of lifestyle. And so, yes, you maybe have crossed that threshold over into diabetes, but I have seen so many patients cross that threshold back into either pre-diabetes or having no evidence of diabetes whatsoever. So again, if you are diabetic, what can you do? Again, those lifestyle changes are even more crucial. So like Dr. J broke down the whole caloric calculations of weight loss. Losing weight will make, and again, people think like, okay, if you're 50 or 75 pounds overweight, oh God, 50 or 75 pounds, that's a hard thing to do. It is, but you don't have to necessarily get to your ideal body weight to get rid of your diabetes. Maybe losing 15, 20 pounds makes a huge difference. So weight loss, diet, exercise, even when you're diabetic, these are actually even more crucial. Again, there are a lot of taking the supplements, taking fish oil, taking vitamin D, taking cinnamon, actually will also help to regulate blood sugar. Taking the antioxidants will help to regulate blood sugar when you are diabetic. There are also medications out there for diabetes. If you recall, we spoke earlier about how diabetes can either be a problem of not making enough insulin or maybe making too much insulin, but your body is just resistant to that insulin. So there are medications, depending on your particular situation, that will either improve your body's production of insulin or improve your body's sensitivity to insulin, depending on what the situation is. So, one thing that I find is, because, we have always kind of been told in our community that diabetes is just a little bit of sugar, that people don't take it seriously. So I've got many diabetic patients, some that are pregnant, some that are, just not pregnant, that are just, regular diabetics. And I ask them, are you checking your blood sugar? The answer is generally no. Or, every once in a while I want to have like a cherry pie or something like that, If you're diabetic, I'm telling you, you will be able to get rid of your diabetes by and large by these lifestyle changes. But until that happens, if you are diabetic, it is absolutely crucial that you've got to check your blood sugar because, again, diabetes is not what's going to kill you. It is the consequences of diabetes. It is that high blood sugar. It is the vascular disease. That's what's going to kill you. So even if you are diabetic, if you're checking your blood sugar and managing your blood sugar, you can still avoid those complications of diabetes. So I think the most important thing, the second most important thing, and the third most important thing is to check your blood sugar. Check your blood sugar and check your blood sugar. Okay.
Now you said, if you are diabetic though, right? And still all of the lifestyle modifications and changes that can help to prevent diabetes are also very helpful when it comes to treating diabetes, and oftentimes will reverse diabetes. But in addition, when you are diabetic, there are certain things you need to do that are going to help to prevent the disease from causing the damage that ultimately can be either life-altering or life-threatening, right? So one thing, make sure you're seeing a podiatrist. Unfortunately, because the blood vessels are diseased in diabetics and you don't get as much blood flow to certain parts of the body, those parts of the body are easily compromised. And the body tends to value what is most valuable, right? So if your body's like, okay, we're not going to be able to get blood flow everywhere, let's make sure we get it to the important parts. We don't need toes. We're going to sacrifice those toes, right? Now, you think, I don't want to sacrifice my toes. But if it comes down to your toes or your heart, your body's going to say, sorry, toes, it's been one, And so you see a lot of diabetics who will have a lot of podiatric disease, and that's why oftentimes when diabetics end up getting amputations, it's legs, below the knee, above the knee, so on and so forth. So see a podiatrist. Also, diabetics oftentimes have neuropathy, where their nerves, aren't working as well as they should.
Because blood flow is not going to the nerves.
Again, because the blood vessels going to the nerves have been compromised. And so oftentimes they'll have foot injuries that can ultimately lead to disease. It can lead to amputation, and they don't know it because they can't feel it. And so it becomes kind of like this 1-2 punch. A, their nerves don't work well, so they don't feel the damage when it occurs. B, because the blood flow is compromised, when there is damage, you can't get the immune cells to the area that you need to help fight the damage and to fix the damage. And so ultimately, they're more prone to disease and injury that can lead to the loss of the limbs. So see a podiatrist, number one. Number two, see an optometrist, right? Or an ophthalmologist. And people hear eye doctor and they don't realize that there are two types of eye doctors. There's an optometrist, there's an ophthalmologist. The ophthalmologist is an MD or a DO. They've gone to medical school and they specialize in the eye. They do surgery on the eye, cataract surgery, things like that. The optometrist is kind of like the eye doctor that you see at Pearl or I don't know, America's Best or whatever the case may be. They do more of the eye tests and they fit your glasses. But either way, both optometrists and ophthalmologists can do in-depth eye exams. And so oftentimes when you are headed in the wrong direction and you're a diabetic, one of the first manifestations will be disease in the blood vessels of the eye. And so you know how they'll do the little test where you put your eye up to the little light and they shine this bright light and they're looking, basically what they're doing is they're taking a picture of your retina.
Blood vessels.
And they're looking at the blood vessels in your retina, and they'll see oftentimes what's called nicking. Or where basically the blood vessels, they'll see the little plaques in the blood vessels and they make these little nicks, and so they can see that. And so going to the eye doctor on a regular basis, ideally once a year, if you're diabetic especially, will A, help you gauge how your diabetes is doing, because they can see if there's more vascular nicking from year to year to year to year. But also it will help ideally to preserve your sight, because when you see that vascular nicking, you're compromising the blood flow to the eye, compromising the blood flow to the eye, you can lose functionality of the eye. So seeing an eye doctor every year, super important. Number three,
I was going to say getting an EKG every year, if not every 6 months. When you're diabetic, again, we talked about this is a disease of the what? The blood vessels. The heart, people think of the heart as being what serves your body, which it is, but the heart doesn't work on its own. It has its own blood supply that feeds the heart, that keeps the heart healthy. So if the blood flow to your heart is compromised, your heart's not going to do well. And that can lead to angina, which is kind of like a pre-heart attack, or it can lead to a heart attack. So getting an EKG every 6 to 12 months will allow your doctor to see the health of your heart before it is compromised.
Get that renal function tested.
Check those kidneys. Absolutely. So this usually is the test called a 24-hour urine protein, which is, like I tell my patients, is what it sounds like. You're going to pee in a cup for 24 hours and collect it. But while we all make protein in our urine, or while we all have protein in our urine, if your kidneys are not working well, you're going to have a lot more of that protein in your urine than you normally would. And again, this is a way to stave off an issue before it's an issue. You want to see, and again, there's a blood test called creatinine also that lets you know how the kidneys are functioning. But it's not like you go from totally healthy kidneys to kidneys that have failed and needing dialysis. It is a stepwise, slow progression. So getting those kidneys checked every year, every 6 months, 12 months, again, will go a long way towards preventing the complications of diabetes.
Also, women, see your gynecologist. This is going to sound
self-serving as we are gynecologists.
Well, not only that, but it's going to sound very strange to patients. But I can diagnose diabetes from looking at a woman's vagina.
Absolutely.
And I have diagnosed diabetes in more than one patient just by when they come for their annual exam. And as soon as I do the annual exam, I don't say it, but I think to myself, you're diabetic, and then we'll send them for the hemoglobin A1C, and they're diabetic. Because what often happens is a couple of things if you're a woman. Number one, you'll get recurrent vaginal infections, oftentimes yeast or something called bacterial vaginosis, which is kind of like a bacterial form of a yeast infection, right? And so you'll get these recurrent infections. And so when you have patients who are coming recurrently with infectious vaginitis, it kind of tips you off. But the diabetic vagina actually has a very characteristic appearance. And the word we use in medicine is plethoric. So the diabetic vagina has a plethoric appearance, meaning it's basically thickened and inflamed. And so you'll often see a thickened and inflamed vaginal mucosa. And then the vulvar skin around it tends to be somewhat scaly. And so just a good guy, hell, even a bad gynecologist, just doing a vaginal exam, they are going to know that you're diabetic, and if you're diabetic, they're going to know that you're not a well-controlled diabetic. I saw a patient this week, and I said, "How are those blood sugars looking?" Just from the exam, I knew they weren't looking good. And she said, "Oh, well, hey, COVID, I've been sitting around not doing much. My hemoglobin A1C is through the roof." And I told her, "This is a problem. This is a problem."
And, sorry, I was going to say, and while we're keeping it below the belt, men, you need to see a urologist because. One thing that, not the only thing, but one of the few things that will get a man checking his blood sugar and getting his health taken care of is the fact that diabetes will lead to impotence. Because again, say it with me, class, diabetes is a disease of the what? Blood vessels. Disease of the blood vessels. What causes an erection? An erection doesn't sound sexy, but an erection is just a lot of blood flow to the penis. But guess what? If your blood vessels are not like this, but they're like that, guess how much blood flow you're going to get to your penis? Like that much. And so you will have either very mildly, well, I was going to say it's not an erection, it's a limp, but I guess mildly firm erections, or you will not be able to get an erection at all.
Suboptimal erections.
Exactly. You'll have suboptimal erections. And even if you get an optimal enough erection and you're able to take care of business, you'll have suboptimal orgasms. Okay? So is that a reason to get to the urologist, guys? Is that a reason to take care of your diabetes? Absolutely. So again, diabetes is a disease of the blood vessels, and it will affect every organ in your body, including your genitalia. And again, same thing for women. Most women, we're taking it a little kind of getting from PG to rated R, but most women, they have orgasms.
I think PG-13 is between PG and rated R.
Okay, whatever. It's PG-15, PG-16. But most orgasms start at the clitoris, right? But again, just like the penis during sexual function is an organ of blood flow, so is the clitoris. And so a lot of women that have poorly controlled diabetes will notice that just their arousal is less than, or their ability to have an orgasm is less than. So if you're not worried about your heart or your kidneys or your brain, think about your penis and your vagina, because those will be affected by diabetes as well. All right, guys. Are there any questions? I'd love to answer questions. We can keep talking. We can talk all day. But
I'll just say one final thing for the women, because obviously we're gynecologists. First of all, we are doctors. We went to med school. We learned about men, women, doesn't matter.
Everybody.
But no, we specialize in women's health. And so one thing for women, especially women of childbearing age, just know that diabetes can sometimes adversely affect your ability to conceive. All right, you're welcome, Bern. But also, if you are a gestational diabetic, meaning if you get diabetes of pregnancy, the likelihood that you will become an overt diabetic or just a diabetic later in life is about 50%. Most people with gestational diabetes, it resolves after the pregnancy, and I could go into the ins and outs of why. But for most people, it does resolve. However, it's kind of a warning sign. It's telling you that,
hey, you're kind of on the cusp.
Yeah, if you don't make lifestyle changes sooner rather than later, you're at risk for developing overt diabetes. And so if you're a gestational diabetic, not only should you be motivated to make changes for your pregnancy, but also know that you need to make lifestyle changes after you deliver, because that's an indicator that you're at much higher risk for developing diabetes later in life. And yeah, you can tell somebody's got diabetes from their vaginal exam if it's poorly controlled diabetes.
Exactly. All right, guys. Well, it has been a pleasure. We'll hang out for another minute or two, see if there are any questions, because this is a very, very important topic. And like I tell people all the time, if you don't want to ask a question for yourself because you are perfect, you got absolutely no health conditions, I get that. But if you want to ask a question, thank you. If you want to ask a question for your friend, your sister, your mom, your neighbor, whoever it is, it's totally confidential. It's just between me, you, and everybody on Facebook. But still, ask the question. We would love to. Thank you so much. We would love to answer any questions out there. Also, if you have a question and maybe it's a slightly bit more personal nature, you can maybe send it to BDO and they can forward it to us, or you can go to our own social media, the Twin Doctors, and we'd be happy to ask it for you. But if you're not too shy, we always recommend asking it for everybody to see, just because the information will be potentially beneficial for everybody. But if you guys don't have any other questions, just remember, these are our takeaway points. Diabetes is a disease of the what? It is a disease of the blood vessels. It is a disease of lifestyle change, or lack of lifestyle change, I should say, which means that lifestyle changes will help you to prevent it or to cure it. So lose weight. Remember, 3,500 calories deficit, that's a pound. Weight loss, exercise, diet, cinnamon, fish oil, vitamin D, antioxidants. Those are all things that will help you prevent diabetes, or if you are diabetic, to keep your diabetes under control. If you are diabetic, remember every 6 to 12 months, you want to get an EKG, you want to get an eye exam, get those kidneys checked out.
Podiatrist.
See a podiatrist, and I don't know if I said it, but get your heart checked out. All right, guys, hopefully this has been beneficial for you. It's been fun for us. We like to talk, as you can see. If you have any questions, you just be sure to hit us up either through blackdoctor.org or through the Twin Doctors. And we will see you guys next time. Hopefully in a better circumstance, but we'll see you guys next time.
All right. Adios, guys.